Let us make you a health administrator. Let us make you a health minister who's responsible for the health of the country, health of India. So now you are converted from being a doctor who's only looking after the next patient, please, into a person who has to care for the healthy and the non-healthy, the entire community, that is the Indian population. So you have to understand the burden of any health problem on the community. For example, any disease, heart disease or cancer disease or communicable disease or injury. Let us write injury here. So all this will cause mortality and will also cause disability. Now, if we will grade the disability from 1, which is the highest, to 6, which is the lowest, we'll have to combine the effect of mortality and disability. So, life years lost to premature mortality are expected life, let us say it was 70, age at death, that was 30. So 40 years of life was lost because of mortality. Now, if the same person got a disability of 5, disability of grade 5, we will divide the years of disability, that is 40, by the grade of disability, that is 5. And you remember that 5 is the lower one. So higher the denominator, lesser will be the years. So you take 40 years because of mortality and 40 plus 40 upon 5, that means 8 years because of disability, and you get 48 years of daily loss in this particular case. Now you combine this overall and you get the total daily loss for the Indian population because of injury or trauma. So this is what you understand by disability adjustment, life years lost because of any particular injury. And this method of calculation was first used by the World Bank to define the burden, global burden of disease. So the daily loss by injury in India in 2017 was 11.4% of 486 million. So this comes out to be 5,54,000. Disability adjusted life years were lost because of injury. And this data has come to you as the health minister. And you are planning to do something to decrease this daily loss because of injury. So you have to prevent injury or disaster. And given if there is injury or disaster, then you have to prevent death and disability and promote cure. And for this, you will have to exactly define in your plan when, where, who will do what with what resource. When, where, who will do what with what resource. So, the biological model we are working on is that the normal is having an accident, is getting injured, and is either dying, getting disabled, or getting cured. So, you want to increase the cure rate and decrease the disability, death, and normal to accident rate. So, decreasing normal to accident rate is known as primary prevention. But decreasing the death and disability rate is known as secondary prevention. And the secondary prevention is by care, which is pre-hospital, hospital, or post-hospital. So you have to strategize and allot your resources or budget in pre-hospital, hospital, or post-hospital care, and all three. Perhaps you have to invest in all three, but you should know where the major portion of your investment should go. So, pre-hospital care will be able to cost rupees 400 per disability adjusted life year saved. Hospital rupees 14,000 per disability adjusted life year saved. And prevention, primary prevention of the accident would cost 40,000 per disability adjusted life year saved. But of course, this 40,000 is non-recurring. It is a one-time investment. So, recurring investment will have to go into pre-hospital care, and non-recurring investment into building two-way roads, which will prevent head-on collision. So, this is the way by which you use cost effectivity analysis to choose where the investment will achieve the maximum effect. So, who will deliver now we are planning the pre-hospital care. So, who will deliver the pre-hospital care? The person at the site of injury. He is basically called as the first responder. And if you train the first responder, it is called as increasing community emergency preparedness. Now we will develop a plan to teach the first responder. And this you may have to do at your sites in primary health centers. So you will tell the first responder that it is a disaster when there are more than 3 victims, because 3 victims cannot be managed properly by one person. So in case of a disaster, you always have to call for help. And the health condition is an emergency if it is time critical. That means as time passes and something is not done, the condition would worsen. Secondly, you have to tell that person that the basic sources of disaster can be remembered by this doha or chaupai. Cheti jal pavak gagan samira. These are the 5 tattvas. Cheti means land, earthquake and landslides. Jal means water. You can drown. You can get lost at sea. There can be a tsunami. Pavak is fire or electricity. Gagan is space, air raid or radiation. Samir is wind, cyclone, tornado or hurricane. And all of them combined, the 5 tattva combined, Panch Rachitaya Adam Sarira. This body, this living thing is formed by these 5 tattvas. And the living thing that can cause disaster ranges from a virus to man. So the first thing that this fellow will have to do is risk mitigation. So risk mitigation is done at various levels. At the government levels, by building two-way roads, by building boundary on roofs so that the person doesn't fall off, earthquake-proof buildings, and from government it can be UNO, which can prevent or stop wars, WHO, which can prevent disease, especially the spread of disease, and the individual person who has to care about the fire, electricity, water hazards, and has to build his house properly. And at the level of corporates, where factories have to be inspected for risky problems and the risk has to be specifically mitigated. Finally, pollution and disposal of dangerous waste has to be enforced. So all these are the things that the first responder will not only know but will try to enforce in his area. So he must recognize the risk and mitigate it. He must recognize the disaster. He must also recognize disaster. And in the case of disaster, the first thing he has to do is save yourself first. From earthquake, from landslide, from water, from fire, from electricity, from microbes, and from animal or man, he must have a plan of action. There's a famous story about the fox and the cat. When the wild dogs came, the cat knew that it can only climb the tree. The fox may have had 100 ways to escape, but it failed to do so because it had options. The cat had only one option, therefore it succeeded and climbed the tree to escape from the wild dogs. So, plan of action. How will you save yourself first? Think about the plan and practice it. The second thing is that if it is a disaster, call for help. And in this call for help, you must practice to call and tell the person when, where, how many have been injured by what, and how to approach the area at the highest speed without any obstruction. This is especially important in case of forest fires. Then the third thing is that you should move yourself and the victim to a safe place. Then you should classify the victim into walking, talking, breathing, and bleeding, broken, dying. You should take help from the walking, talking, breathing and help the bleeding, broken, dying. This is called as triage. It was described by the chief medical surgeon of Napoleon Bonaparte. Triage. Classify multiple casualties and label them. Life endangering, label red. Limb endangering, label orange. Will need OPD treatment, label green. Already dead, label black. So that was developed by the chief military surgeon of Napoleon the Great in dealing with war casualties. And now you have to deal with bleeding, elevation and pressure. If the pressure outside is higher, example compression bandage, and inside the vessel is lower, example elevation, then given some time there will be clotting and the gap will seal. So you should use elevation and pressure and not a tourniquet as far as possible. Then you should suspect shock and you should replace blood by blood as soon as possible, as fast as possible. If not blood, plasma. If not plasma, plasma expander. Otherwise, ringer lactate. then bleeding, and then broken. You see, cervical spine, you can prevent rotation by a 4-post collar, and you should prevent bending of the neck in the laterally. For example, if this is the person lying on the one of the sides laterally, lying laterally on the bed, then a pillow which has the height from the shoulder to the cheek will prevent bending of the neck. Third thing is that you should rotate the head, the shoulder and the pelvis together so that there is no rotational strain on the spine, and this is called as the log roll. Then if there is a fracture of the spine here, you should support it at this point, that point and this point, and then you should lift this patient by 3-point support. 2 people shake hand and support the middle. This fellow lifts the head and this fellow by the other hand lifts the pelvis. So this is called as the handshake method of lifting the patient. Then you splint the upper limbs to the chest, lower limbs to each other. You prevent dying by aspiration. So you empty the mouth, you clean the pharynx, you suck the trachea if there are sounds. If there is a cardiac arrest, you do cardiopulmonary resuscitation. And one important thing is that if there is a breathing difficulty, then suspect pneumothorax. Confirm it by an X-ray or by a tympanatic note on percussion, absent breath sounds and tracheal shift. And you must decompress it by putting a 16-gauge needle in the second intercostal space as soon as possible, because this is something which is time critical and it can kill the patient. Then you have to transport to the nearest hospital where the problem of all the problems of the patient can be managed. You transport with full information, your contact number, and with full instructions as to what has to be done during the transportation. Then don't fear legal complications. Always stop and help. The Supreme Court has ordered that person who helps or has good intention will not be harassed by the police or the legal process. If you are the perpetrator of the accident, then if you stop, you may be beaten. Therefore, you have to go to the nearest police station and report. If you do this, then you are safe from legal problems and also from the local crowd who can get angry and beat you or destroy your property. So this in general covers the pre-hospital role of the first responder or the doctor. And this you will have to teach to people around you who may be the drivers, the traffic police, etc.